I think you mentioned that 24% of your patients are Advantage. Is that correct?
24% of our Medicare patients are now Medicare Advantage.
Okay. And is the treatment that they receive any different from a person that's under regular Medicare versus a person that might have some sort of private health care versus, is there anybody that still pays for it out of their own pocket in your practice, or they all have one of those coverages?
We do have an Amish community around us who pay cash, so yes, we do have self-pay patients and a few uninsured.
So the question would be, how is the care,
in our mind, when they get back to see the doctor, there's no change, there's no directive to not see a patient in a certain manner or take care for them in any way differently.
And as a business person, do you have any preference amongst the 4 different categories that we talked about?
Well, I certainly would like to see an insured patient who I know the rules rather than an insured patient who I don't know the rules, because this patient may have to be directed to a particular hospital. This patient may have to have certain services done before they'll be approved for surgery. So there could be a variety of reasons why I need to have information prior to. But currently, the way our practice operates, the physician would probably know what kind of insurance the person has, so that he might, for instance, say, well, I see that you have to be done at this particular hospital, so, that's I go there on Wednesdays, that kind of thing. But other than that, we do not do anything differently. We have a few instances, too, where we have to get prior permission from a patient to do services on Medicare Advantage patients. They have to sign a release. Very rare, but occasional. And so we have to be cognizant of that.
Okay, thank you. Dr. Wilson, I think you had mentioned the 11th hour intervention. And going back to the question that I had asked in the previous panel about how disruptive is it, how inconvenient is it that Congress doesn't act so we don't tell you ahead of time what the rules are going to be, when you're going to get the money, how much it's going to be. How disruptive is that when you're practicing medicine?
Well, first let me thank you for the question you asked, because it was good to hear that CMS does think there is a time certain that they could make those changes. It was chilling, though, to realize that the cuts are already locked in the computers, so we hope something will happen in time for that to be changed. Well, clearly, small businesses cannot plan for the future unless they have some way of estimating what their income is going to be. So if your estimate of what the income is going to be what's certain is that there could be a 10% cut, you can't plan for that future. You're really planning for survival. So to think that one can add new technology in the way of health information technology or other medical technology which comes across the way, those uncertainties for any small business are exaggerated in physician practices.
Okay, thank you. Dr. Mabry, you had mentioned that you're a small business, and so you face the same challenges that other small businesses do, even outside the medical profession. Is it accurate that you would also, in the other challenges that you face, they would include things like energy costs and how they've been going through the roof, and so you're paying those same costs as well? In fact, even in the products that you have to purchase, with diesel being as high as it is right now, the inflationary factor and all the things, if you buy a chair for your office, for example. So in other words, and even the federal inheritance death tax, when one has to plan for the future. So you face all those same problems that other businesses would face as well. Is that correct?
Yes, sir. I think all the practices have to bear the burden and the brunt of any inflationary increases from their suppliers, and that goes without saying. Another thing that we've not talked about today, but it's certainly a very true phenomenon, is the increase in health insurance premiums that the small businesses have to shoulder. We're healthcare providers, but we have no control over the cost of health insurance, which is going up and is harder to get. Mm-hmm. So that's another inflationary cost. And as Dr. Wilson pointed out, it's not just small things such as tongue blades in our practice are endoscopes that we use to do screening colonoscopy for colon cancer. They're getting old. my partner and I are trying to decide if we can buy those or not. Well, we don't know. We don't know what the next 6 months is going to hold. So those sort of things are real life examples of how it's becoming more and more difficult to practice medicine. It's hard enough to practice medicine and surgery, but now we have to worry about the business aspects of it, and that just adds more to the problem.
Thank you. And then for all the doctors, does it continue to be a problem or something that you have in your mind, the potential of having a lawsuit filed against you and the challenges that one faces, and sometimes frivolous suits, but nonetheless you still have to defend them? Is that still an issue that resonates, that you think that should be dealt with either at the state level or at the federal level? And I invite any of the doctors.
Well, it is a part of the real world, and it is never far from the surface. It's a fair observation to say that liability premiums, the rises have tapered in the last year, but they have stopped rising as fast, but they are at unconscionable levels. So that if you're an OBGYN in Miami, Florida, and paying $247,000 a year, that's a constant financial reminder of those challenges. And then I think the thing that you were alluding to, and that is the apprehension about taking that trip, even if you're acquitted, if you're sued, taking that trip and the hassles of that is what drives a lot of what we call euphemistically defensive medicine, which we know, and actually I guess the CBO office has indicated adds another $120 billion to the cost of health care in this country. So we are still very concerned.
Would the gentleman yield?
I'd be happy to yield.
Doctor, is insurers consolidation an issue that is in your mind?
Oh, absolutely, and not just in terms of liability, but particularly in terms of health insurance.
So it's not only tort reform and liability issues, one of the biggest issues that you have to confront, but also the insurer consolidation. So it has to be coupled with insurance reform.
Our plate is full.
Okay.
Yielding back.
Okay, thank you. And reclaiming my time, just one last question. Also, the marginal tax rates, income taxes on everyone was reduced somewhat over the last few years, and capital gains taxes were reduced and those types of things. Those tax cuts were not permanent, unfortunately, because we didn't have the votes in the Senate to make them permanent. So they're going to go back up in a couple of years unless Congress does something to make those tax cuts permanent. Is that a concern to the members of the panel, or do you want to have your taxes go up?
It's an easy one.
Anybody want to take Mr. D'Angelo, since I hadn't talked to you?
The idea of taxes increasing, I don't think excites anybody sitting at the table, so it is a concern. Anything that is going to increase our expenses for the small physical therapist practice has the potential to be extremely detrimental, because we're literally right now working on it in a survival mode. An example, Dr. Mabry just brought up that his health insurance goes up every year. I just got my renewal notice for our small company, and this year it goes up in June, and they're proposing 49.5% increase in my premiums. I don't know how that's justified, but I know it's something that we cannot afford. And so we are in a situation where we really live paycheck to paycheck in the small business. And so anything that's going to increase expenses anywhere, we're not going to be able to make it, quite frankly.
Okay. Thank you. Dr. Dale?
I'll comment, because I think doctors are interested both in the cost and in the revenue side of government. But I would say that doctors are good citizens. They pay the taxes, and they pay them as happily as anyone else. And I think that in terms of paying for Medicare, that we've been happy participants on both sides. And I'd say, in talking to physicians, they appreciate the value of Medicare to the public, but also to themselves.